When you're rehabbing a hip labral tear, it's important to not just stretch and strengthen the hip muscles, but that you also want to make sure you're addressing the core stabilizing muscles. You need to evaluate the gait and see if you can improve someone's walking. You also want to look at the person's activities that may have led to the labral tear in the first place. So for example, painful hip labral tears are common in dancers, football, soccer players, and other types of athletes. So on one hand, some of that risk is just baked into the activity, but not all of the risk, and some of the risk can certainly be at least minimized. The first thing is to look at the form of the performing artist or the athlete. So if the person's a golfer, for example, you look at the golf swing to see if it's putting too much unnecessary torque on the hip. The same goes for dancers and everyone else. Then too, if you're a soccer player doing lots of quick pivots, you're going to need to do double the work on strengthening the muscles that allow you to make those fast pivots without putting too much stress on the hip. One other point when you're rehabbing a hip labral tear. It's not the norm, but sometimes someone develops a hip labral tear because they also happen to have a pinched nerve in the back. Specifically, the most common scenario is someone with an L5 pinched nerve. The L5 nerve root innervates the hip abductor muscles, and if the L5 isn't talking well with those muscles, then when you go to turn or to pivot or to land after a jump or just walk, the muscles that should be protecting your hip might not turn on as well or at the right time, and that will lead to extra stress on the hip, and that can lead to a hip labral tear. This is something you need to identify if it's present, because if you don't identify it, there's a strong tendency for the labral tear to become symptomatic again and again. If the back is involved, it's vitally important to address it one way or another so that as the hip labrum heals, the hip abductors will get the innervation that they need. Sometimes addressing the L5 nerve root can just mean appropriate exercises devoted to the lumbar spine. At other times, it might mean an injection or even a surgery. Of course, the treatment is going to vary wildly depending on how badly and from what the nerve is compromised.